5 types of pain after 70 you should never ignore. They could be signs of trouble. Pain is something that almost everyone has experienced at some point in their life, but as we get older, pain can become a frequent visitor. It's a normal part of aging, right? Well, not always. While some aches and pains are just the result of getting older, others could be signs that something more serious is going on. If you're over 70, there are certain types of pain you should never ignore. These pains could be your body's way of telling you that something deeper is happening and it's important to get checked out sooner rather than later. Let's break down 5 types of pain after 70 that could be signs of trouble. Let's kick things off with a conversation about joint pain. It's one of those things that's so common, we might brush it off as just a part of getting older. But if you've been dealing with persistent pain in your knees, hips, or shoulders, and it doesn't seem to get better, it might be more than just the normal wear and tear on your body. While some joint pain is indeed part of the aging process, when it intensifies or interferes with your daily life, it could be a sign of something more serious, like arthritis or osteoporosis. And trust me, ignoring it might lead to bigger problems down the road. Take Evelyn, for example. She's a 73-year-old woman who had been dealing with stiff knees for years. At first, she thought, it's just part of getting older. We all know the feeling. You wake up with a creaky knee, maybe some mild discomfort, and you tell yourself it'll pass. But as time went on, Evelyn noticed that the pain didn't just go away. It got worse. She had trouble getting up from chairs. Walking up the stairs became a challenge, and she found herself taking longer to recover after a busy day. She told herself, maybe I just need a bit more rest, but the pain didn't seem to improve. One day, Evelyn had a moment that changed everything. She was simply trying to walk across the room, and it felt like her knees were giving out beneath her. That's when she decided it was time to see her doctor. After a series of tests and x-rays, Evelyn was diagnosed with osteoarthritis, a condition where the cartilage in the joints wears down over time, leading to pain, stiffness, and swelling. The knee pain she had been experiencing for years wasn't just the normal aches and pains of aging, it was a clear sign that her joints were deteriorating. The severity of her pain and the impact it was having on her daily life were red flags. Fortunately, Evelyn's story didn't end in a lifetime of pain. After following a treatment plan that included physical therapy, medication, and some lifestyle changes, she began to see relief. The swelling went down, and her mobility improved, allowing her to return to doing the things she loved. The moral of Evelyn's story? If you've been putting up with joint pain that's affecting your ability to move, don't wait to get it checked out. Whether it's arthritis or another underlying condition, seeking treatment early can make a huge difference in how you feel. Don't let joint pain hold you back. Take action now. Let's talk about chest pain for a moment, and trust me, this is one of those things you never want to brush off. Chest pain is often the first thing that comes to mind when we think about heart problems, and for good reason. However, did you know that chest pain can also be caused by a variety of conditions that have absolutely nothing to do with your heart? I know, it sounds confusing, but that's why we need to pay attention to the details. First things first, chest pain can absolutely signal something serious, like a heart attack, angina, or other heart-related issues. But it's important to know that it could also come from something seemingly less scary, like acid reflux, gallstones, or even a pulled muscle. The tricky part is figuring out when it's time to get concerned, especially after the age of 70. If your chest pain feels like pressure, tightness, or squeezing, and especially if it radiates down your left arm, it's time to take a seat and dial your doctor, or, better yet, head straight to the hospital. The sooner, the better. Let's take a look at John, a 75-year-old man from Liverpool, who had been feeling perfectly fine until one evening. He was sitting in his favorite armchair, enjoying a good book, when he suddenly felt a tightness in his chest. Ah, it must be just indigestion, he thought. After all, he had enjoyed a big dinner earlier, and it was nothing unusual for him to occasionally get a little uncomfortable after a hearty meal. But the discomfort didn't go away. It lingered and seemed to worsen as the night went on. Not only that, but he started feeling lightheaded and nauseous. At this point, John wasn't sure what was going on, but he knew something wasn't right. After some urging from his wife, John decided to go to the hospital. After several tests and an EKG, it turned out John was having a mild heart attack. The doctors told him that while the damage wasn't as severe as it could have been, if he had waited any longer, the outcome might not have been so positive. John was lucky that he listened to his body and sought help when he did. His heart attack was manageable, but it was a wake-up call that chest pain should never be ignored, no matter how familiar or minor it seems. The takeaway from John's story is clear: any unexplained chest pain should never be brushed off. It doesn't matter if you think it's just indigestion or something less serious. Chest pain can be a signal that something much more serious is going on in your body. The earlier you seek help, the better the chances of minimizing damage and improving your overall health. So, if you're ever in doubt, don't wait. Get it checked out, because early intervention could save your life. Another type of pain you shouldn't ignore is severe or sudden back pain. Back pain, especially as we age, is something almost everyone experiences at some point. It's one of those things we tend to write off as just part of getting older. A little stiffness here, a dull ache there, and we think it's no big deal. But there's a big difference between your average back pain and something that could be signaling a more serious problem. If the pain is sudden, sharp, or shooting, or if it doesn't improve with rest, it's time to pay attention. This type of back pain could be the result of a herniated disc, spinal stenosis, or even a spinal fracture, things that require immediate medical attention. Let me tell you about George, an 80-year-old man from the UK who had always prided himself on staying fit and active. George had spent his life hiking, gardening, and staying on his feet as much as possible. He had never been a couch potato, and he always kept his weight in check. But one morning, George woke up to something he hadn't felt before: a sharp, shooting pain in his lower back. He thought it was just a tweak or a muscle pull, so he did what most of us would do: he tried to power through it. But as the hours passed, the pain didn't subside. It worsened, especially when he tried to stand up or walk. Every step felt like a struggle, and bending down to tie his shoes became impossible. After a few days of this worsening pain, George could no longer ignore it. He could hardly move without wincing, and his usual routine of walking to the local cafe for his morning coffee had become a distant memory. George finally decided to go see his doctor, who quickly ran some tests and ordered an MRI. The diagnosis? A herniated disc in his lower back. Essentially, one of the discs in his spine had ruptured, pressing against the surrounding nerves and causing the sharp pain he had been feeling. The good news was that George wasn't dealing with permanent damage, but had he waited much longer, the situation could have gotten worse. His doctor put him on a regimen of physical therapy and prescribed medication to manage the pain. Over time, George began to feel better, but he was reminded that ignoring severe or sudden back pain can lead to long-term issues. A herniated disc can worsen if left untreated, potentially causing permanent nerve damage or paralysis. So, what's the takeaway here? If you experience sudden and severe back pain, don't wait for it to get better on its own. Even if you think it's just muscle strain or bad posture, it's worth getting checked out. Back pain could be a sign of a serious underlying condition that requires prompt treatment. It's always better to be safe than sorry, and in George's case, early treatment made all the difference. Don't let back pain hold you back. Get it checked out and keep moving forward. Now, let's talk about abdominal pain. Abdominal pain is one of those symptoms that almost everyone has experienced at some point. Maybe it's just a little indigestion or a bloated stomach after a big meal, right? Well, as we get older, that abdominal discomfort can sometimes signal something much more serious. Persistent or recurring abdominal pain, especially when it's paired with other symptoms like nausea, vomiting, or changes in your bowel movements, could be the body's way of telling you that something needs attention. From digestive issues like diverticulitis and gallstones to more serious conditions like colon cancer, abdominal pain is not something to brush off. Take Margaret's story, for example. Margaret was a 72-year-old woman who had been dealing with occasional stomach discomfort for months. At first, she thought it was just typical indigestion or bloating after a meal. After all, she had indulged in a rich lunch or too many cups of coffee on more than one occasion, so she just assumed it was nothing to worry about. But as time passed, the pain didn't go away. It started to become more frequent and, most concerning of all, more intense. Margaret started noticing that the pain was no longer just uncomfortable, it was downright painful, especially after eating. One day, Margaret noticed something else that made her sit up and pay attention: blood in her stool. She tried to brush it off as nothing serious, but deep down, she knew something wasn't right. After a few more weeks of worsening symptoms, Margaret finally decided to see her doctor. Her doctor ordered a thorough examination and a few tests, including a colonoscopy. The diagnosis came as a shock: Margaret had colon cancer. Thankfully, because she caught it early, the cancer was still in the early stages and had not spread. With the right treatment plan, which included surgery and follow-up care, Margaret was able to recover and regain her health. The lesson here is clear: abdominal pain that doesn't go away, especially when paired with symptoms like nausea, vomiting, blood in the stool, or any changes in your digestion, should never be ignored. It's easy to think that it's just a bit of indigestion or a passing stomach bug, but when these symptoms persist or worsen, it's your body's way of asking for help. The sooner you get a diagnosis, the better your chances for successful treatment. Margaret was fortunate enough to have caught her condition early, and it made all the difference in her recovery. If you're experiencing any unusual abdominal pain or discomfort, don't wait for it to go away on its own. Get checked out. Your health is worth it. Lastly, let's talk about leg pain, which is often overlooked but should never be ignored. Leg pain is something we often shrug off as part of getting older. After all, as we age, we can't expect to feel as spry as we did in our younger years, right? But here's the thing: persistent leg pain, especially if it's accompanied by swelling, numbness, or discoloration, shouldn't be ignored. These symptoms could be your body trying to tell you that something more serious is going on. While a little discomfort might just be due to inactivity or muscle strain, it could also be a sign of circulatory problems or even a blood clot, which can be very dangerous. Take Claire, a 78-year-old woman from Edinburgh, as an example. Claire had always been an active person, spending her days gardening, walking around her neighborhood, and keeping up with her grandchildren. But recently, she had noticed that her legs were starting to feel heavier, especially by the end of the day. She thought it was just a normal part of aging, maybe her body telling her she needed more rest. But things took a concerning turn when Claire noticed that her left leg was becoming swollen and, to her surprise, turning a reddish color. At first, she thought it was just some sort of irritation or maybe a sprain from an awkward step. But as the redness spread and the pain increased, she began to worry. Claire, being the cautious person she was, decided to see her doctor. After a thorough examination and some tests, the doctor confirmed that she had deep vein thrombosis, DVT, a condition where a blood clot forms in the deep veins of the legs. DVT is something that shouldn't be taken lightly, as it can lead to severe complications. If the clot breaks free, it can travel to the lungs and cause a pulmonary embolism, which can be life-threatening. It was a scary moment for Claire, but fortunately, because she caught it early, her doctor prescribed blood thinners to dissolve the clot and prevent further complications. Thanks to the quick action and the proper treatment, Claire was able to avoid the worst-case scenario. However, her experience serves as an important reminder that leg pain, especially when it's accompanied by swelling, redness, or warmth, is not something to brush off. If you notice these symptoms, don't wait to seek medical attention. A blood clot or circulatory issue can develop quickly, and the sooner you address it, the better your chances for avoiding serious health problems. So, if your legs are sending you signals that something isn't quite right, don't hesitate to get checked out. It could save your life. To wrap it all up, pain is a signal from your body, telling you that something might be wrong. As we age, it's easy to dismiss pain as just a normal part of getting older, but the truth is that certain types of pain should never be ignored. Joint pain, chest pain, severe back pain, abdominal pain, and leg pain are all types of pain that can point to serious underlying health problems. If you're experiencing any of these, don't brush them off. See your doctor as soon as possible. Remember, early detection and treatment can make all the difference in your quality of life and overall health. Your body is trying to tell you something, so listen to it.